Alright, in this video I'm going to show you how to gown in gloves. So what I want to do is find a good spot to gown from that's not on my back table, it's not on a dirty area in the room. I can use an empty mayo stand like this. Got my gown, I'm going to create my sterile field, opening it away, side to side and towards me. Now I've created a sterile field. I've got my 1-inch sterile barrier, just like if I was opening up a Foley kit. I have my gloves. I'm going to open these to the sterile field. And now I'm ready to go scrub. So let's say I've scrubbed. I'm ready to go. Used Avogard so I don't have to dry off. So I'm going to take this and move it out of the way. And then I'm going to pick up my gown. Trying to get my hand under the cuff, and then I'm going to put it on. So I'm going to pick it up, step away, and put it on. Remember that this area right here will be on the inside, so this is going to be unsterile once you put it on. But this little sliver right here, that's going to be on the outside, that's sterile. So you need to be very careful about where you grab when you put your gown on. All right, the first thing I want to talk about is so you've opened your sterile field as far as your gown and your gloves. You're ready to go out and scrub. So you need to remove any jewelry, any rings, watches, earrings, anything that could fall off, anything that's on your hands or arms before you scrub. And you need to make sure that you have the correct PPE on. Here, our PPE is hair covering, eye protection, and a mask. Optional is boot covers, shoe covers, x-ray gown if you're using fluoro or anything like that. Make sure that you're doing a little self-inventory before you go out and scrub, because you don't want to embarrass yourself and come into the OR scrubbed and then you forget to put your glasses on or whatever, your x-ray gown, and then you have to start over. And usually it's somebody else that calls you out for it. Okay, so now I'm going to put my gown on. I'm going to take my right hand, I'm going to place it under the cuff. I'm going to grip the whole gown so it doesn't unfold. I'm going to step away, because remember, 12 inches from any type of sterile field. Put my left hand through the other cuff on the other side, and I'm going to let it fall. I'm not really going to shake it. I'm just going to let it fall. And now I'm going to put my arms through. I'm not going to go up with my arms or down, because remember, you can't put once you're scrubbed, you can't put your hands above your shoulders or below the level of your sterile field or your waist. So I'm going to put, instead of going up or down, I'm going to kind of go out with my arms, being careful that the sides, the cuffs and everything, the sleeves don't hit something, because then I'd have to start over and get a new sterile gown. So, all right, so now I've got my gown on. My circulator is going to come behind me and tie me up, and then I'll put on my sterile gloves. All right, so now I'm ready to put on my sterile gloves. I'm keeping my hands from going through these cuffs, because once my hands go through the cuffs, they're unsterile. So I'm keeping my hands down into the sleeve. Okay, and I'm being sure that I'm keeping my arms at the appropriate level, that I'm not going to bump into anything, and I'm keeping my body 12 inches from this mayo. I wanted to give you a close-up of me putting my gloves on, because the other video I shot, you really couldn't see it. So, got my gown on. My fingers are not through my cuffs. Once they go through the cuffs become unsterile. So, take my gloves, I'm gonna open them up. I'm gonna take my right hand, I'm gonna take it and place it on here. I've got my fingers pointing down my arm, my thumb on the underside. I'm gonna pinch the top cuff and pinch the bottom cuff. I'm going to pull it over my hand like that. Once I get some fingers through, now I'm going to pull my sleeve down so that I can get all my fingers free. Like that. Now I'm going to do the same thing with the other hand. Fingers pointed towards my elbow, thumb on the underside. I'm going to try to pinch the bottom cuff, pinch the top cuff, pinch the bottom, pinch the top, and pull it over like that. And then pull my sleeve down a little bit and get my hand free. You can see that where my cuffs are. They're right there in the middle of my hand. I don't want them down here on my wrist, because then throughout the case it'll work out from under my glove and my arm will be unsterile. Okay, so I've got my gown and gloves on. So now I want to spin. So this card right here has got a white half and a purple half. So if you're going to, let's say, spin with your circulator who is not scrubbed, you'll take this, you'll hold the short string, pull it off, you'll hand the card to the circulator, they'll grab it on the purple part, they'll hold it while you spin around. I don't have anybody to assist me, or I would. Let's see. You spin around, they would pull that card off, throw it away, use it for notes, and then you can tie your gown on the side right here. All right, so now I am gowned and gloved. Let's talk about the sterile areas that I've created on my gown. So on your arms, I've scrubbed to 2 inches above my elbow, so I'm sterile from 2 inches above my elbow down to my fingertips. Okay, my upper arm is not sterile, my armpits are not sterile, my shoulders are not sterile, my back is not sterile, okay? So on my chest, I'm sterile from 2 inches below this neckline down to my sterile field. So if I'm working at a tall table and I'm up against it, my sterile field is from here to here. And it doesn't, if I step away, it doesn't go down, it stays small. So typically, the back tables come up to my waist, so this is my sterile area for most cases, okay? Not around the sides, that's unsterile. Remember, throughout the case, keep my hands somewhere between shoulder height and waist, or the sterile field. You can go out with your arms, you can't go up or down. You want to be mindful of your surroundings, stay close to your sterile field, don't wander throughout the room. Don't go over to the nurse's computer and check things out. You're trying to limit traffic and everything, anything that can disrupt the airflow in the room. Trying to stay close to your sterile field and be available and stay sterile. When you're scrubbed like this, you're not supposed to change levels. So that means if I'm gonna sit for this case, I don't need to sit and stand back up and work. I need to sit and stay seated throughout the whole case, because I've changed my sterile area. So when I get back up, I may not be sterile in the same area and contaminate something, okay? So armpits are not sterile, mainly because it's a high friction area and it's going to be moist as you start to sweat, so it's going to break down your barrier, the gown. So the gown's impervious to a certain extent, but it can be worn down and then it becomes ineffective. So your armpits will eventually become unsterile. Your back is unsterile because you can't observe it. Your circulator's also touched it, can't watch it. So if I'm scrubbed and I need to move throughout my sterile field and I need to pass by another person that's scrubbed, I'm either gonna go face to face, front to front, so sterile to sterile, or I'm gonna turn around and they'll turn around and I'll go back to back, unsterile to unsterile, okay? Okay, how to take the gown off. First thing I'm gonna do is untie the side. I'm gonna pop the back. I'm gonna pull my shoulders down, and I'm kind of wadding it into a ball inside out, because I don't want all the blood and fluid and anything that's on the outside of my gown to get on anything. And then I'm gonna take my thumb, gonna get it under the cuff of my glove on my right hand and pull that out. Now I've got this hand, go to my left glove, pull that out, and now my gloves are inside of there, and I can throw this away. Okay, one other thing I wanted to show you was if I did a traditional scrub and my hands and arms are wet and they're dripping water, then I want to dry my hands off. The gowns usually come with a little sterile towel that you can use to dry your hands off. All right, it has an ear on it, so I'm gonna grab this ear, this little folded ear, step away from my sterile field, and try to shake this out. Not too much though, it goes right here, right? So then I'm gonna place it in this hand, underside. I'm gonna dry this arm and hand off. The technique I'm going to use is I'm not going to bring this towards me, because if this touches me, it becomes unsterile and I have to throw it away. What I'm going to do is I'm going to push this arm through. So I'm going to start my fingers, dry my hands, I'm going to work my way up my arm, all the way to my elbow. All right, so now I'm ready for my other hand. I take the hand I just dried, place it onto the other side, and then now I've got this hand and arm that I'm going to dry off. Same technique, starting my fingertips, working down, pushing this arm through, drying it off. Okay. Now I've got this, it's garbage, I'm going to throw it in the garbage, not on the floor. Right, so now I'm dry and I'm ready to gown and glove. Okay. One other thing I wanted to note was body posture. You should have an exaggerated body posture. Doesn't feel natural, but it will keep you from contaminating yourself. So you want to, almost like you're grabbing a barrel is what you want to do, right? So you're kind of lean forward with your arms out. That way your arms aren't hitting your scrubs. If you have shorter arms like me, sometimes my sleeve will come down and touch. Sometimes I'll accidentally touch my scrubs, and then I'd have to re-scrub, right? Also, if you're going to scrub, if you're outside of the scrub sink, you're going to go from there straight into the OR room, and you're going to push through the door. For whatever reason, it's just reflex that when people push with their back, their arms want to come forward, and they'll hit themselves and contaminate. So when be exaggerated, be mindful when you're pushing through that door. Make sure to keep your arms out. Okay?